Yes.
So I'd like to welcome Dr. Beverley Duguid to deliver our presentation today. Welcome, Beverley.
Thank you. Can everyone hear me okay? Just thumbs up and things. Put in the chat if you've got any difficulties so that we know. I think I've been made co-host, so if anyone has any problems, just put a note in the chat to let me know. As Beverley said, my name is Beverley Duguid, and I have lived experience of glaucoma. Been living with glaucoma for about just over 10 years. I'm a Londoner and live in West London. And I'm also own my own business called Insight Mind, which I set up 2 years ago. And mainly as I go through my talk, you'll hear different things about me. I've just kind of interspersed a talk with different things about myself, my lived experience, to highlight some of the examples. But hopefully I'll be able to hear about some other people as we go along. So like I say, I've got glaucoma for 10 years and discovered this through a routine eye test. So one of the reasons why I set up Insight Mind was because of basically the anxiety and mental health issues I saw around me in the visually impaired community, and also other people with other issues, other disabilities, where I saw that mental health was an issue as well. So really, I set it up because of that. So, like I said, 2 years ago, I investigated how I could do it, and got some funding to put on various courses around mindfulness and around literature and poetry to get people to take their mind off their problems, really, and to think about what stress they were under. So like I said, I'll talk a bit more about Insight Mind as I go along. So I just wanted to start the talk off with just thinking about what is mental health, and then later on, further down the talk, we'll think about the links and why there are such links, like I found before I set up Insight Mind, why there are these links with sight loss. And the answers may be obvious to a lot of you, but I think to a lot of the sighted community, sometimes it's not so obvious why it would be so. So we all have mental health, okay? That's one of the things that I wanted to talk about and take away the kind of stigma around the phrase mental health or the words mental health. So mental health is just like our physical health. And we wouldn't think twice about not taking care of our physical health. But often mental health is secondary. And that can be for a number of reasons. That can be for cultural reasons, could be for stigma that we think about in society around, oh gosh, something's wrong with me, mentally. We have an image in our head, maybe. And perhaps you can stop and think about what is it? And in our discussion afterwards, what is your definition of mental health? So just like our physical health, our mental health is constantly changing. So we've just gone through the pandemic, and that was all around our physical health. And a lot of us may be left with things from COVID. So some of us might know someone who's got long COVID, or we might have been affected by COVID, where our physical health is affected. But our mental health is so linked to that as well. So there's a definition of mental health. I'll share my screen for those who can see. Those who can't, I will say what's on the slide. I've only got 3 slides. So just put that out properly. So the World Health Organization defined mental health as a state of well-being in which every individual realizes his or her own potential, can cope with the normal stresses of life, can work productively and fruitfully, and is able to make a contribution to her or his community. So that's the World Health Organization definition of mental health. But there's others, but that's just a general catch-all definition of how we should be. So how many people feel constantly that they're in that state? And that's the question, I think. You know, how often do we all, you know, we go through so many ups and downs in our life. Forget our sight for the moment, our eyesight and the problems we might have. In our life in general, how many of us say that consistently we are in that state? And that's what we need to think about. So if we think about mental health and mental illness, they're not the same. So our mental health is the big catch-all thing for all the issues that could be wrong with our mind. Mental health is much more. It's much more than the absence of mental illness. So people try to separate mental health and mental illness, but mental health includes mental illness. But we often want to shy away from that side of mental health, where we could become unwell, we could have an illness. So people don't want to be labeled, like I said earlier, don't want to be suffering from stigma. So it's only recently that diagnoses such as bipolar have been discussed on TV when they've been endorsed by celebrities who have come out and said, oh, I've got bipolar. Or you know, or more, or other mood disorders like an anxiety disorder. So we can have anxiety, but specific disorders come under the category of mental illness. Or for example, more serious illnesses where you have to have medication like schizophrenia. So I would say all of mental illness is still under our mental health, because even those people who have schizophrenia or bipolar and they're on medication can be well. They can live their lives normally, in inverted commas. So this is what I want you to kind of think about, that whole idea of mental health and mental illness, and what we will find acceptable and what we won't find acceptable. So when we think about the serious side of mental health and mental illness, like schizophrenia, sometimes these things are given bad press, like criminals who go on killing sprees, you know, or we are told that they've had diminished responsibility because of their mental health. They didn't know what they were doing because of their mental health. So these brings up other discussions around the issue. So the issue is quite broad. So when we talk about mental health, our own mental health is on a continuum, I would say, ranging from good mental health, like in the World Health Organization statement, to having a diagnosis of severe mental illness. So it's a wide category. So what we're talking about today is our sight and how that our sight can impact our mental health and how it can lead to being unwell with our mental health and the stigma that can develop around that for us, for our families, friends, and wider society that you might feel. So sometimes the words around mental health, so if we talk about, oh, I've got a mental health issue, mental ill health. So you might be suffering from anxiety, low mood, depression. One of the most common forms of mental health or being unwell with your mental health is depression. You don't always need to take medication, but you might do. So we normally call it mental illness when you have a specific diagnosis, like I've just said. So how can we deal with our mental health? What does it mean to us? How can we describe it? So there's something that I learned, I put a picture up on the screen, and it's called stress, a stress container. So that's what I wanted to talk about next, is stress. Stress is one of the biggest issues in the world, I think, and one of the biggest causes of mental health problems. how much stress we are taking in, how stress is affecting our bodies. And I'm sure we'll all agree, having an eye condition at times has led us to have problems with stress, how we deal with stress. So what's in your stress container? So on the screen, I have an upside down triangle, and it describes how you contain stress in your body. So the upside down triangle is the container. And it says vulnerability is shown by the size of the container. So I would say most of us have a medium-sized container, or on average, but some people have a smaller container. So when their stress flows in to their container, they can't contain it before they become unwell, or they have difficulties or start struggling. Okay, and so it can be helpful. And also, sorry, if the container overflows, like I was just saying, that's where the problems start developing. Okay, so for example, what could affect the size of your container is what the problems you've had in the past. So if you were someone who's suffered from abuse, family problems, if you've had, couple problems, relationship problems, that could affect the size of your container. Okay, so then when you then start having other issues, so for example, when I started having my eye problems and I didn't know what was going on, my container was medium sized. I could cope with a bit of stress at that time. But as the issues became worse and worse, my container began to get smaller and smaller. And I began to suffer with anxiety because I wasn't letting out the stress. I was holding on to the stress. Okay. So then how you get rid of the stress, there's a tap at the bottom of the container where you can get rid of the stress. So you open the tap, and then you've developed coping strategies to get rid of the stress, and your container then becomes more stable. So if you want to read about this, there's an organization called Mental Health First Aid England, where I got this from. I did a course with them. My organization now is Mental Health Aware because of the course I did with them. So we can get Bhavini to put that in anything she sends out. I've got the website address on the slide, if anyone can see. But it's called the stress container. So it kind of gives you an idea of how our body, it's like the fight or flight. We'll talk about that later as well. So your position varies at certain points in your life, depending on what's going on. And I think this is where sight loss comes in, and serious eye conditions that affect your life, I would say. So not just, it's just something that affects your life. So I wanted to stress to you that sight loss can affect our physical and our mental health. So I think it's something that sometimes, I mean, you may think about it, but I think a lot of people don't really think about it. So for example, if you have AMD, age-related macular degeneration, you might have to have injections. I've had to have injections after my eye operations. Each time I've had an eye procedure called trabeculectomy, and if on my right eye, and if I do have another operation on the eye, which I did, I had to have cataracts. I have to go through the same procedure, and I'm sure this might be familiar to some of you, where you have steroids injected into your eyes to help the healing process. So I have to have that up to 6 weeks after the operation. So these injections, I think I found them very, very physically disturbing, draining. I felt physically sick at times. They made me feel unwell, basically. And also, if you do go through a number of eye operations, or your eye condition itself can be painful. People don't think that their eyes can affect their whole body, but they do. So your general mental health can also be affected for that as well. So if we're then suffering from stress on top of an eye condition, this is where problems can also come. So there are some studies that have said that things like if your retina is an extension of your eye, your brain, and so any kind of eye disease can actually be a brain disease in disguise. So it has the same effects on your vascular system as you would high blood pressure and any other problem with your veins that you might have. So chronic stress can result in hypertension, digestive dysfunction, depression, anxiety, and the biggest thing of all, which I've written about a bit on my blog, fear. Fear is one of the, next to stress, fear resulting from what we think is going to happen to us because of something, can lead to issues with our visual system. And again, there's a website I can give you with details about, it's called naturalecare.com, and they have a blog and they talk about the effect of stress on our eyes. So also the other thing they mention is so glaucoma, optic neuropathy, dry eye syndrome. All stress can aggravate these diseases and even aggravate diabetic retinopathy and macular degeneration. So sometimes stress can cause us to feel dizzy, give us eye strain, give us sensitivity to light, sometimes give us floaters as well. These are the things that stress can, if you're feeling really stressed about your eyes already, or if you're feeling stressed about something else, they can have an effect on our vision. So it's very important that we watch our reaction to stress, how much we can contain, like I said, our container. Where are we already before we go into a stressful situation? Sometimes we don't know we're going to go into a stressful situation, and we go into one with a reduced container. So then it's about watching where our stress is. So now I thought I'd go on to talk about when you first have a diagnosis and some of the things you might feel, some of the things that might cause you stress when you first, or might have done, you might have experience of this already. So this is all on the RNIB website, so you can read this for yourself as well. And together with an article Wayne Chapman and I wrote for the BAME Vision website last year. So you can have a look at that as well. It's around mental health and has some links and tips in there as well. And different links to counselling, links to all the different major eyesight charities, like Glaucoma UK. Yeah, so you can have a look at that. So basically I've got about 7 topics and we can talk a little bit about those as well afterwards. I just checked my timing. Right, okay. So the first thing is what you might go through when you've got a diagnosis is shock or denial. Okay. So I agree with all of these, and some of these I've experienced. So it's whether sight loss comes on suddenly or after a diagnosis is confirmed and you've been dealing with it for a long time, or you've been experienced gradual change. Shock is often the first reaction. And I remember when I was told that the peripheral vision I'd lost in my eye wouldn't come back, I think I just stayed in that hospital room for about a week, in terms of, like, not physically, but in terms of mentally. I could not move on from what they had told me. And I was told like it was nothing, that I was just shown a diagram, and the diagram said that I'd lost a great deal of vision in one eye, and I was just told I wouldn't get that back. And I was for someone who was I still am a writer, but I had to go through a big process before I realized I could still be a writer. But at the time, I thought that was it. It was all I was going to lose my sight. I knew nothing about RNIB. I knew nothing about London Vision. It didn't exist then, but I didn't know anything about any of the charities that could help me to continue my career. I just thought, if I can't see, I can't write. And I thought I was going to go blind, totally blind. And that's where I stayed, I would say, for about 4 years until I started working again. But I was just in a state of shock. So it can be hard to take the news about your sight, and the stress that comes on after that depends on where you are in your life. You know, you could be a breadwinner and then you think, oh my God, I can't work anymore. So that comes on, or you could have children and you think, well, how am I going to cope? You know, what am I going to do? And then you've got everything else compounded. So the second thing is anger and questioning. So that comes. So I know you've probably heard as well that once you've had a diagnosis of sight loss, or you're dealing with sight loss, it is like a grieving process. So it's just the same as having a bereavement. So you probably have heard that. So you go through these same things, anger and questioning. So, and this can depend on how you lost your sight. These are all legitimate to be angry. Suppose you had an accident and you lost your sight. Suppose it wasn't your fault. You know, you were just walking down the road one day, had an accident. So you'd be questioning, you'd be angry. Why has this happened to me? Why me? So number 3, you then feel helpless. And I mentioned fear before, fear and anxiety. Again, anxiety is one of the biggest things that people talk to me about. You know, why do I feel anxious? Why is it, I don't feel anxious in everyday life, but why do I have this fear of what's going to happen? It's fear of the future, fear of what's going to happen. Would this get worse? You may have been left without a diagnosis. You may have been just told, well, we don't know what's going to happen with your sight. So you just feel anxious about the future. You don't know how to continue. You may feel sad. And again, like I said, grief, it's like a bereavement, losing sight or your sight going. It's like a death, someone dying. So you experience the same emotions as if you've lost somebody. So this can be particularly difficult for people who are very practical. I was one of these people, just coped. I just got on and did whatever I had to do. I just cope with everything, cope with emergencies, cope with things. And then you're just struck with this diagnosis. So, you know, you can cope, but you have to talk about your feelings. There's people who can think, oh yeah, I'll just cope, I'll just get on with it. But then they don't talk about what they're feeling underneath. And then that's when it festers. And then, like I said, your container may be quite okay, but by the time you get to the next year, it might be chipping away. You're not letting out that stress. How are you going to let that stress out? That's one of the questions we can talk about as well. How do you let your stress out? So depression, I mentioned earlier. So that's one of the most common responses to stress is depression. Okay, so people will just lose hope. As a GP described it to me when I said that I said to him that I didn't want to think about the future, that I, had lost hope. And he said that really is one of the ways that you would describe depression. So I would always say to you, go to your GP if you're feeling like that, hopeless. Speak to your GP, a counsellor. So if you feel that you persistently don't want to get up, you don't want to eat, you have disturbed sleep, you can't be bothered to see friends and family, we don't do the things that you normally do, see your GP. I would always advise you to go there first. If you can't speak to a friend and family, you can't speak to your partner, or you don't want to burden them, then speak to your GP first. So the other thing is loss of identity. So you might not be able to do the things you used to do before when you've lost sight. So it's about readapting. Like I mentioned, someone who might be have been the breadwinner, or they might have been, you know, a budding artist, aspiring sports person, and then they think, I can't do these things now. There are ways that we know that people can still continue their lives with a visual impairment. But when you're first going through these issues, you just don't know what you want to do and how you're going to do it. So it's about talking to people, talking to services, rehabilitation. You'll be referred to, eventually referred to social services. If you are eligible to be certified, then you go on to receive help from your local authority. And one of these things should be to be offered counselling if you need counselling, to be offered peer support, going to a group, being in contact with charities like London Vision. So some of the tips again on my naturaleyecare.com website is what we talk about is trying to keep yourself occupied, trying to keep yourself in a good state of health generally for your eyes. So exercise, you don't have to do loads of exercise, but going for a walk, keeping moving. I've started teaching now, I'm trained as a mindfulness teacher now, and I started teaching mindful movements. There's very slow, gentle movements that really help your body. So particularly when you've just had treatment for your eyes, it's always good to take things slowly. You know, you don't have to go off and run a marathon, or do yoga or get into anything. Just going for a walk in the park, keeping active, finding that new identity that you may have to find. So there may be other things that you can think of that we add, what I call to a toolbox. How are you going to release the stress from that container that's built up? All about releasing stress and finding ways that you can release the stress. So I think that for me, that's the issue. Just, you know, that we have so much built up that we don't know. So like I said, I set up Insight Mind because of the anxiety, the topic of anxiety I was a researcher when I worked for the sight loss sector. And I kept seeing these and hearing stories about stress and anxiety and how much the sight loss, the visually impaired community disproportionately suffered with mental health issues. So some of the stats I saw, 31% of blind and partially sighted people are really or never optimistic about the future. That's an RNIB study. 17% of people experiencing sight loss are offered emotional support in relation to their deteriorating vision. Only 17%. So people have said they had to find support themselves, they had to ask friends and family, and work, they had to throw themselves into work, into their own hobbies. More than 4 in 10 people attending low vision clinics are suffering from symptoms of clinical depression. So those are some of the top statistics. The last one, the 4 in 10 people, is the one that I always talk about. 4 in 10, and that's not changed. I think that was only 2015, that research. So how can we cope with this stress that may result from having our eye condition? So the way that I have found to cope is through mindfulness. The mindfulness has taught me how to pause, how to deal with anxiety, how to deal with spiraling thoughts. And I'll stop in a few minutes because I know I was told to stop it. So I'm going over a bit. So mindfulness is a moment by moment awareness. And so through sitting practices like meditation, even art, writing, eating, we can learn to cope with everyday situations. So let me just see if I've got Here we are. So I've got a list up of some of the ways that we can cope with stress in our lives and keep our mental health well. So one of the ways is mindfulness. Obviously, we'll do a little practice in a minute. So ways to maintain positive mental health include, like I said, getting professional help if you need it. Go to your GP if you are feeling hopeless. If you experience any of those topics that I said, you don't want to get out of bed, you stop talking to people. Connect with other people. Stay positive. Get physically active, like I said. Go for a walk. You don't have to be doing loads of exercise. It's just about moving your body a bit. Walk into the shops and get in the bus. If you have to go out with someone, making arrangements to go with someone so that you can, go and have a walk together. Helping others. I know it can be difficult, but helping other people. And this is why we find that people who have gone through adversity or who have had really, difficult things in their lives, set charities up. These are the people who run marathons to help charity. People who have had adversity find it helpful to help other people when they're going through difficult circumstances. So you might be going through a difficult period now and you might think, oh God, I can't think of helping someone else now. I can barely help myself. But, when you're well or when you'll feel a bit better, maybe you could do some voluntary work or you can do something online. Doesn't have to be anything really big. Getting enough sleep. Sleep deprivation is the biggest destabilizer. From someone I know myself who's gone through lack of sleep and insomnia, it can make you feel awful, because it can affect your work, then affect you looking after your family. It can affect a very bad effect on your body. And then developing coping skills. So like mindfulness, like I said, learning to control your breath. That's one of the things we teach you in mindfulness, is learning to control your breath and how deep breathing can help. Listening to books, listening to music, being in nature, socializing. I can give this list to Bhavini as well. I can put this together for you to have a look at. But with me, mindfulness was the key, because mindfulness was the only thing where I found that was non-judgmental. So it's a non-judgmental practice where you come as you are. You don't have any expectations. You don't have to sit in a particular way. You can do mindfulness on the tube, meditation on the tube. You can do it on a bus, walking, and it just gets you out of your head, away from those thoughts that you might, again, and the biggest contribution to stress is our minds. What's going to happen? The questions we sit and ask ourselves. What's going to happen? How am I going to cope? And you can, and that can lead to insomnia. Sitting awake, go ruminating, and mindfulness can help you to focus away from those thoughts. So I'll stop now, and for any questions, and then perhaps I've got a few more things about mindfulness, and then I thought we'd just do like a 3-minute breath and body meditation that we could do together. But thank you very much for listening. I hope you found it informative.
Thanks, Beverley. I was thinking if we go straight into the mindfulness now, as it's part of the recording. So if anyone does want to practice afterwards, they can watch the recording and just be guided by the meditation, if that's okay.
Yep, okay. Right, so if I thought I'd just do one for about like 5 minutes, since we only got a short time. And this one is called, this practice is called the 3-minute breathing space. And it's really can calm you down if you're anxious, but it can also, if you just want to stop and pause in the middle of your day to just take stock, or to just, you're feeling anxious or you're not feeling anxious, you just want to pause and stop. So if you just come to a You can do this standing up, lying down, sitting on a chair, anything you want. As long as I would say you have your feet in contact with the floor. If you uncross your legs, I have your hands in your lap. And then if you have sight, you can have a soft gaze to about 2 meters in front of you, or you can have your eyes as you want. So if you just come into this present moment, and you can just think, how are you now? What's going on for you now? How are you feeling in your body? And I invite you to come into contact with those points of support. So what I mean by them, where are you feeling those points of contact? Your feet on the floor, your bottom on the chair, your back against the chair. What do you find there? What sensations do you find there? Your sole against the floor, your feet in the sock, your clothes against your skin. What do you feel? Is it softness, tingling? And then bring your awareness gently to the breath in the body. Breath in the body. Where's your breath located in your body? Is it in your nostrils, your chest, or your tummy? And you might want to put your hand on your tummy. Feel your breath, the in and out motion of your breath. Where's your breath located in your body? And then you may find that your mind's being taken away to thoughts, to what's going to happen next. What do I have to do later? What am I going to eat later? Your mind might be being dragged away, but just bring it back to your breath. And just normal breath. Don't try to force your breath. Just follow your breath through your body. And then when you're ready, become aware of the way the air around your body. Become aware of your whole body and the air around your body and where the two meet. And how our breath is connected to that. As we breathe in and out. How our breath is connected. Because we're not still even though we think we're still. We're not still because we're breathing. So become aware of the whole body, as if your whole body is breathing into the air around you. In and out motion of the breath. Breath around the body, taking in the whole body, while sitting here or lying or standing. And then if you take a deep breath in from your feet all the way up your body, up through your belly, your chest, your throat, and then out through your nose as you come back into the room. Back into the room when you're ready. Thank you. Thank you very much. Hope I haven't put you all to sleep.
Thank you, Beverley. That was amazing. I resonated with so many of the points you mentioned in your presentation, and that session was just so relaxing. Wakey, wakey, everyone. If anyone does have any questions they want to ask Beverley, we can stop the recording now, so we're not recording any of the questions, so feel free to be open as much as you'd like to be.